You're tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. Jeannie Roller is on with me today, and we're talking, Jeannie, about the Kaiser Permanente healthcare workers strike. I mean, I just find it amazing. I've got one article here that was written on Reuters. It's by Leroy Leo and Bahavi Sadaja. I hope I pronounced that right or close. I apologize if I didn't. But it's talking about some issues that you and I talk about all the time, and one of them is that the unions are asking Kaiser to make massive investment in education and training of future healthcare workers. I was like, I almost fell down when I read that. I was like, is that because, and I want to not think, is that because the ones that you have aren't well educated, the ones that you utilize aren't well educated? Also, it does say that Kaiser is one of the preeminent largest U.S. medical employers. So that's disturbing, too. So now you have people that are striking because they're saying that there needs to be more education and training for future healthcare workers. They also want diminished role for vendors and third-party contractors that the healthcare network relies on. So we need some more information about that. So we know that they rely on third care and third party and contract healthcare network. You know, what does all that mean? I got to do some more information about that. And another thing, of course, it's always the money, and I get that. I do get that. And it's also unfair labor practices. So what does that mean, unfair labor practices? Does it mean that you're utilizing people too many hours? And I know I saw myself on national TV. Many of the strikers are carrying the banners that say, you know, patient care, forefront. You know, we need better patient care. So if the medical people are saying that, a lot of times in my experience, if you ask the workers actually what's going on, they know bottom line rather than just reading it in data or reading it in, you know, a pamphlet or something like that. The people that are on the front lines know the story. They do. So, Jeannie, what do you think about this? I mean, Kaiser is huge. It's in many, 20 states and D.C. in the United States. So yeah. A good part of the country. Yeah. And are they steering the healthcare that we're not getting?
Well, yeah, I mean, these big corporation hospitals, they do kind of dictate care out there. I mean, I'm not saying that Kaiser is running other hospitals out, but when you have so many corporate hospitals, they do tend to run out the small independent county type hospitals. The thing about, you know, the healthcare workers carrying signs saying better patient care, define that for me, nurse, tech. Define what your definition of better patient care is. Is it the same definition as mine, the person receiving the care? That's worrisome to me, because apparently it's not, or we wouldn't have so much harm happening in medical care. The other thing is the education thing. Well, sure, everyone wants their education for free or paid for. Is that what they're wanting? Are they saying that, well, we don't think we should have to suffer debt to get an education in order to make more money than maybe someone working at a convenience store? Mm-hmm. Is that what they're wanting? Then that's what it kind of sounds like to me. As far as, you know, the vendors, in my opinion, is corporation hospitals tend to use like employment agencies to fill positions, which then upsets the staff, because they see these people getting actually paid more money and then paying an employment agency, you know, to have that person there. So they're thinking, well, they can pay, and I'm just pulling this out of the air, $100,000 for this one traveling person, but they're only paying me $60,000. Mm-hmm. I think it may have something to do with that. The other thing is, you know, typically nursing, you work like 4 12-hour shifts or 3 12-hour shifts, however it figures out. You work 10 or 12 hours at a time. So, you know, they do work hard, on most of them, and, you know, they probably don't want to work as hard. It's most of the time you would think that they would be on their feet. So, that takes into consideration the wear and tear on their bodies.
Mm-hmm.
But, I just think healthcare workers, if it was really about the patients, then why are you out there on strike while the patients are in the hospital suffering from lack of care?
Well, Kaiser on one of the shows that I saw said that they had hired people that, were taking the place of the ones that were on strike, and that
Right.
the care wasn't diminished. And I'm just, that's basically a quote from that. And I just didn't want to put my opinion in there of what possibly could be happening. But, I'm with you. We talk about it all the time. I mean, will this bring notoriety to how bad the patient care is, if it's really going to delve into how bad the actual patient care is? Or is it going to just smooth over and be settled, and as long as more money is paid and education is paid, if that's if that slant of what you're saying is correct, comes to fruition? I mean, here it also says they want higher pay to keep up with the cost of living. Well, everybody wants that. That $25 an hour is the minimum wage for all healthcare workers. And they also want to reform bonus structure. So $25 minimum wage for all healthcare workers. Does that include the CNA that has a weekend of training? That's
Probably.
the schooling that person went to. I mean, and that is real. It's reality in this healthcare system that we're dealing with. I ask people all the time what their training are when I go to different appointments or when I have conversations with healthcare workers. I ask them, where did you go to school? What's your training? I know there's a local program here that an RN actually can be an RN in 9 months. I can't fathom how you whittled it down. It used to be 4 years, and now that person is actually a registered nurse in 9 months. That just blows my mind. And I ask him, what's the extent of the training? Do you get hands-on patient training? Oh, yeah, we have it for a couple of weeks. So it blows my mind, some of the things that pass for the healthcare now.
Yeah.
It really does.
Yeah.
So a lot of that gets lost in the cracks of the floor when it gets thrown to the floor because, okay, that part doesn't matter. Let's hurry up and get you into the system is the way I read it. Is that what some of this stuff is talking about? I mean, I hope it is, that it's addressing some of this stuff. There are a lot of thousands and thousands of great doctors and nurses and healthcare workers out there. I don't want to see them in that same situation. It's got to be awful if you're working next to a person that doesn't really have the calling, if you will, and also the training, if you will, to back you up. I mean, do you have to train the people while you're actually working on the patient? I'm being kind of facetious, but I mean, is that what we're doing now? I don't get it. I don't get it. So anyway, I mean, kudos to them if they go on strike for the right reasons and some of this can get settled. And also kudos to bring a lot of this to the forefront for the rest of us, for the listeners to know that a lot of this stuff is being, and on my word, manipulated by these big box healthcare systems that have taken over smaller hospitals, smaller venues, and what's been thrown to the wayside when that happens. Because I see the bottom line is money, is what I see. It's profit, it's data, profit, supply and demand. That's what I see. A lot of the care. And it is a shame for the people that are in it for the right reasons, the doctors that are in it the right reasons. And I get it. Yeah, the burnout has got to be unbelievable, especially going through this COVID, it was. Really. Right. So your last thoughts, Jeannie? We got like a minute left.
Well, Cindy, I think it's mostly about money. That's my opinion. I think that, the hospital systems, when on strike, they will give them the money. But then I think what happens as a result is that they hire less nurses. They put more work on the remaining nurses. Mm-hmm. And then the patients are the ones who actually suffer big time. Yeah, well, that's what we talk about all the time. That's why we do this, you and I and the other people that call in and the listeners that we have, that you have to bring voice to this because it's not right what we see happening, and the bills aren't getting any cheaper for us for our insurance, and the waiting time is longer to see a doctor, and the time that you actually see a doctor is less and less and less. So on that note, stay tuned to Evergreen Media Network.